Good afternoon, everyone. Thank you for joining us for another edition of TEPHI Talks. This has been an ongoing series since 2021 to talk about business-to-business connections with regard to impacts of potentially infectious diseases and how we can maintain vibrant economies while making sure that we protect the people that we serve. So we have a really exciting presentation today because we have a whole tag team of folks that are going to be presenting. But before we get into that, what I'd like to do is kick it over to the Deputy Director of the Texas Epidemic Public Health Institute, Dr. Janelle Rios, who will give a few introductory remarks and some kind of basic rules for the game, so to speak, so that we can manage when people come in with questions, which we encourage, but using the text box and stuff like that. So I'll kick it over to Janelle at this point. So.
Thank you, Dr. Emery. Hi, everybody. I'm Janelle Rios. I'm Deputy Director of the Texas Epidemic Public Health Institute, or TEPHI, as we affectionately refer to it. We are a group, the statewide group, that are committed to keeping Texans safe from infectious diseases and our economy strong by protecting our workforce. And we're also dedicated to strengthening the capacity and resiliency of our communities to respond to future outbreaks. Now, those communities could be local health departments, they could be hospital systems, they could be a nonprofit group. So we have a very broad definition of our communities. And we support them through a series of different training and educational opportunities. For example, here's a photo of the Texas Public Health Summit that was held on October 20th, just a couple months ago here in Houston, but was hybrid, so you can attend it online from anywhere in the world. And we had a theme of wastewater science this past time. Keep this in mind because we are doing this annually, and every year we have a different theme, a public health theme that I think will be very interesting to this particular audience. Now, we don't do this alone. We have an army of collaborators out there in the world, and specifically in Texas. We are housed within the University of Texas Health Science System at Houston, also called UT Health Houston, because that's a mouthful. Our collaborators are in governmental agencies, in regional and statewide organizations, professional associations. We have lots of different collaborations there, produce growers, restaurant association, and we're very happy about those collaborations because we're able to reach those specific communities. We have collaborations with business entities such as Shell and HEB and other for-profit companies. We have collaborations with other academic institutions, for example, Baylor College of Medicine, who do the bulk of the wastewater analysis for us, and lots of different community organizations. And here I mean specifically nonprofit organizations. And talking about collaborations, Shell Health is a longtime supporter of our School of Public Health, and specifically our NIOSH Education and Research Center, which is based out of Houston on the 10th floor, which is where I am right now. And so thank you, Shell, for all of your past support. While I'm thanking people, I do want to thank Dr. Sanchez for really pulling this group together so that we can produce this event today. Now, if you'd like to connect with us, here are lots of different ways to connect. We have live in-person trainings. We have live webinars like this TEPHI Talk. We have Grand Rounds, which is online and live as well, and recorded on our YouTube channel. We have the summit, as I explained before, down here, and we have lots of different resources on our website. And if you need something and you don't see it, please contact us because we need to develop that for Texas. This is truly an agency for Texas. And no matter who you are out there in the world, if you are another state agency or a high school science teacher and everybody in between, I really want you to contact us with your needs. Okay, so I'm going to move on to webinar housekeeping. Now, we have closed captioning here. So near the bottom of your screen, I believe it's at the bottom, there's a live transcript button. Press that and you'll get the closed captioning. If you have a question, please use the Q&A box. It's helpful because we have a moderator who is pulling those questions together, and we're going to ask them those questions of our presenters near the end of the webcast. Let's see, you will be given a survey at the end. As soon as you exit the webinar, you'll receive a survey. Please let us know how we did. That's very important because we base future editions of our webinar based on your comments. And please know that this webinar is being recorded. If you registered for this, and probably all of you did unless you're watching it as a group, we will send you an email with a link to the recording in about a week. You can also go onto our YouTube channel, and here's the address for you, and look at past webcasts. And this is a really nice resource, and hopefully you'll utilize it. So now I'm going to send it back to Bob so he can introduce our speakers.
Sure. All right. Thank you, Janelle. So just a little bit of frame of reference before we get into the introductions here, which I'm going to keep brief because the bios are actually posted on the webpage associated with this presentation. But when TEPHI was created, which was in the midst of the pandemic, our assignment was to assist businesses to be able to maintain operations in one way or another. And so what we did was we started sorting businesses by major industrial classifications. And so we've had, as Janelle has mentioned, we've had the restaurant industry, we've had the retail industry and the like. And so one of the groups that we really wanted to get a hold of was the oil and gas and the energy sector. So we're very pleased to have Shell USA participating here today, because I think there's a perspective not only for what issues to be addressed in Texas, but also internationally because of the scope of the work that's carried out. But I wanted to make sure that attendees of this webinar understand that I think everyone has experienced COVID fatigue, and I guess we're learning to live with it, whether we like it or not. But really, the intent of this presentation and the subsequent presentations that we will have as we go forward with TEPHI Talks is, what did we learn? And then what are we doing going forward? Because that's what businesses really need to know. So we're very fortunate to have a panel here. We have Dr. Alex Wynn, Health Manager Upstream Americas at Shell USA. Dr. Eileen Hoff, Regional Lead Human Factors Americas in Shell USA. Dr. Hans Berg, Regional Health Manager of Americas at Shell USA as well. And then last but not least, Dr. Brian Smalley, Health Manager, Chemicals and Products, U.S. Downstream for Shell USA. So I'm going to turn it over to you guys. Thank you so much for taking time to share your knowledge and experiences with this. And I guess you guys can share your screen and go from there. So thank you.
Thank you. Okay. Let me kick it off. So this is Hans. Can we go to the next slide? So we're gonna give a perspective from an international company. So that might be slightly different from previous presentations, where the company is local, and in our case, we have a long, proud and presence in Texas, but Shell USA is part of Shell International. And at the time of COVID, the headquarters were still in The Hague. It has since moved to London. And that is also where the global coordination team was based. So that's why we've cut it up in these sections. So I'll try and give, as best I can, the perspective from that group, if you will. And then Eileen will give, the perspective of a country response. Brian will try and relate what it was like at a particular asset. And then Alex has developed our pandemic response plan for a next event, which hopefully will not be around the corner or at any time during our lifetime. But I think we all realize the need to be prepared. If you go to the next slide. Yeah, this is perhaps a typical shall slide because we're, of course, very strong on not just health, but also on safety. So every meeting that we start, we will go over some of the safety items, and especially one thing that we often pick out is for people not to try and drive and be on the call at the same time. If we go into the actual presentation, okay, I'm going to kick it off. I think what was really important for us, and I think maybe I didn't even realize it at the start, is that the first thing that we did is set out what our main objectives were. And we identified three. One was no harm to people. The other one was business continuity. So optimal mitigation of any impact operationally or financially. And thirdly, it was to protect our reputation. So maintaining trust with not just our staff, but also in our case with customers, with suppliers, with investors, with governments, and with the society at large. And all of that enabled by adhering to our core business values, which are honesty, integrity, and respect. And this may seem very obvious, these objectives, but I think during the course of the whole event, we very often found ourselves avoiding going down a rabbit hole because somebody would say, hey, what were the main objectives again? And we'd go back to that and really keep that front of mind. Yeah, I think in terms of the trust, I mean, it's easy for us to write that, but I think we were a trusted partner before this started, so we were in a good position. And we also had one of our executive committee members who ran the global coordination team, who was very well experienced with working with the functions and also had huge respect and was aware of the available expertise in the company, not just in health, but in many of the other functions that we have. And I think that was very helpful at the onset. I think what we also were very conscious of as a health function in the company is that we stuck to our lane. So we kind of delineated where we felt really kind of responsible for something like, okay, what is the PPE that really needs to be recommended here versus when we were more in a subject matter expert role, kind of advising HR or real estate or whoever that may be. I think one thing that happened at the beginning was, or that kind of developed quite quickly, is to have really broad representation. So very senior leaders of each of our business lines were represented right from the start. And then, it started out as a health issue, but obviously the impact was such that, everybody became involved. And therefore, we had, besides the senior business representation from travel, from safety, from HR, from real estate, and internal communication. And I think they all really played a very important part. In terms of communication, which I think was absolutely key during the whole event, besides global messages, we also catered to very specific audiences. So we were very well aware of where we needed to have bespoke communication, for instance, business continuity focal points, those people that were really kind of keeping the assets running at a local level, our expatriates, for instance, and especially also our country chairs. And I'll come back to that in a minute. And all of this was supported by a dedicated website. And I think what was also really important is that we had, we continue to develop FAQs, frequently answered questions, asked questions, and those were updated in real time. Now, in terms of communication during a crisis, I think most of you will be familiar with the principles, either 4 or 6, depending on who you look towards to. I think the CDC has 6, which are be first, be right, be credible. And I think the credibility was really important. And that also meant, being honest, and also being honest when we didn't know anything, when we didn't know something. and to express sympathy and show respect. I think, you know, there was arguably quite a lot of crazy stuff out there and ideas, but people were also really uncertain and anxious, and showing that respect and listening, I think was really key. And then also to make sure that whenever we did bring out messages, the last principle is to promote action, is to make sure it wasn't just information, but, you know, it was actually, you know, giving advice on what to do very specifically. So I think, you know, although I think we were trusted, I think, yeah, and I think one of the main things why that worked, and why you know, the bottom bullet point here says there were no negative impacts and significant positive impacts, is that we really stuck to our guns and really maintained this, you know, we maintained this being rooted in science and being directed by evidence. And actually that meant saying no quite a lot. And there was a time where I felt that my email signature should be I am Dr. No, but I didn't do that. If we can go to the next slide. So like I said, I think to develop that trust and maintain it, it was really important to have evidence-based decisions. I think all of you can relate to the fact that that was not easy. You know, especially in Europe, you could have Belgium say one thing and the Netherlands could actually say the opposite. The science really developed very, very rapidly. But I think we were greatly helped by having in-house epidemiologists who really kept on top of the literature, and you know, we followed that kind of in real time. And I think especially why this was important is I think it allowed us to achieve a high level of equity. There's nothing that's more demoralizing than finding out, especially during crisis, that one group is treated very differently from another group. So you cannot decide to evacuate a group of people from one country and then the next month apply completely different criteria to another group of people in a different country. And so I think that was you know, really important. I think there are two ways in which we also managed to achieve that besides being evidence-based. And that was recognizing that although this was a global crisis, the response was very much local. So we empowered our country chairs, our local businesses to, you know, to respond to the crisis, to align themselves with local public health information, and of course to, you know, maintain, you know, be with it, you know, and be compliant with local law and regulations. And so what we did is, in order to maintain equity, we did develop what we called handrails, or certain principles. So, and we took out big topics like testing, vaccination, PPE, social distancing, return to work, and provided the country chairs and the businesses with handrails, which were not prescriptive, but they would say around PPE, you know, these are the recommended masks, or social distancing, this is a recommended distance, and so on. And I think that degree of flexibility, you know, helped everyone, especially in the US. I think the CDC is a national organization, but almost acts like and is seen as an international organization. Yeah, and I think last but not least, like I said before, I think we recognized that there were certain groups of people who were more vulnerable, and making sure that they felt catered to and cared for, and that required some bespoke communication and measures. And of course, there were lots of people in situations that were much higher risk because they were far removed from hospital care. So our offshore environment, our people on ships, and remote areas in the desert, and so on. And so we made sure that that we had specific handrails for them and specific communication and guidance. And I think I will stop there and hand over to you, Ali.
So I was fortunate enough to participate and represent Shell Health as part of the country response for the US. And so I wanted to share with you in reflecting upon everything that happened over the course of those years, where the efforts were as we think about the pandemic period potentially having four pieces: the early days, the period where we started to have information, the period where the vaccine came out and things were starting to normalize, and then the normalization period, where the efforts of that team really focused and some of the things that we focused on. We'll look at it from the perspective of the country, the business, and people, because our team tried to look at everything through those three lenses to make sure that we were addressing the concerns of everyone and how they related to Shell as a whole. So a lot of the things you'll see from a country perspective persisted across the whole time. So collaborating with the different organizations, there are many, many organizations that are represented in Shell USA, making sure we understood everyone's circumstances. You'll also see that communicating consistently, as Dr. Berg mentioned, was a very persistent activity. Learning from the evolving science, so leveraging what came from Shell Health, but also looking at the other things that people were seeing so that we made sure we were aware of what everyone was potentially taking in. Communicating policy and health specific information. Those are the things that were really constantly on our plate. But early on, and consolidating efforts across the lines of business, again, many businesses all coming together. The bulk of that activity happened in the first portion of the pandemic, but it still continued on as we refined and as the businesses changed their models. Creating a structure for the response was key. We took a human factors approach to that from an early perspective to create the framework, which I was very pleased to see. The first half of the pandemic was really about learning how to manage staff. Some of them were in the office, some of them were not. How could we support the different businesses? How as we as a country would create policy and help to provide some of those guardrails that Dr. Berg mentioned. Data collection, which we'll hear a little bit about later, was also a huge part. What data did we need to collect? How are we going to keep it and where? And what was going to be of value long term, because we really didn't know that in the beginning. We also had some businesses that needed a bit more care, as was mentioned. And so figuring out how to manage them, how to manage their stakeholders and their employees when it was a business that maybe was used to having a bit more bespoke care and continuity, and we didn't really necessarily have that. Coordinating globally with Shell Health, with some of our other business partners globally. And then toward the end of the pandemic, as a country, we started to look at the cultural shifts and the issues affecting equity, as well as some of the things that were happening with our workforces. And that became a big focus toward the end. And of course, public health messaging, once that became clear and consistent, there was a lot of focus on making sure that we communicated that we were receiving that information and helping folks to understand it. And if we look at the next slide, which is from a business perspective, again, that structure in the early days was really key. Not only the structures within the businesses and how they were going to communicate and manage their staff, but how they were going to relate to the country, to their other operations in different parts of the world. Again, communication was something that was really strongly chased by the business throughout the pandemic, making sure that people had the information that they needed, the right perspectives, leveraging the Shell Health messaging to make sure that people felt that they had a reliable source of information. And then toward the end, as our staffing changed, as our working models changed, and we saw more folks working remotely, either part-time or full-time, that was definitely an impact with the business. Our data collection, again, what did the business need as opposed to what the corporation might need in the US? What made sense and how to manage that effectively and appropriately. And then again, the cultural issues and equity. Shell has a big focus on diversity, equity, and inclusion. And so making sure that as we return to our new normal, that was part of the conversation as well. And the final part on the last slide is really to think about, from our perspective, as employees, as people, as well as part of this team, what did individual contributors in the organization need? And we heard time and time again that communication was what they wanted. They wanted to know what Shell thought, as much as Shell was able to communicate with them. So things like the website, we did some really well-attended video conversations where we presented technical information as well as took questions, generated that bank for the FAQs, but making sure that we were consistent and communicating on a regular basis. We also know that people were also very interested in the science that was evolving. And so certainly in the beginning, that wasn't the mindset. The mindset was, really around just staying safe. But there was a lot of interest in the science. And so that's where Shell Health Epidemiology was a huge contributor, putting out some regular communications. But we saw a lot of questions coming from people. Sometimes they asked the right people, sometimes they were asking each other, and that's how misinformation, can travel. So we were really trying to make sure that we got with people and help them to understand that. And then, like most people, there was a lot of conversation in every organization, and people were concerned about work-life balance and those issues around staffing and where was I going to work and how is I going to work. And so we recognized that that was definitely an issue people were concerned with, less toward the end of the pandemic, because I think a lot of organizations had at least moved into a temporary position where folks were comfortable. And of course, that's evolved for a lot of companies and a lot of people since then. Leveraging internal skills and knowledge was also something that people in the organization were asking about, particularly as people were working from home and they weren't sure about what they needed to do, how our businesses were going to be impacted, how that would impact their work, their ability to collaborate, their access to resources. So there was a big interest in skills and knowledge and how to move that forward. And again, the people, the business, and the corporation, all toward the pandemic and the end of the pandemic and moving forward, focusing on those cultural shifts and the concepts around equity and how we make sure that everyone comes out of the pandemic and is treated fairly. And the last thing was around questioning public health messaging. So especially during some of the earlier days, there were some messages that weren't always clear and consistent. And so that was a big issue that people in the organization looked to Shell Health and to the country leadership teams for. They had lots of questions. They were happy to ask some of those questions and maybe argue back on some of the answers. But that was a huge concern, and again, drove us to do some of the communications in targeted ways around webinars, the weekly letters that we did through some of our websites, and communications through specific individuals. So from a corporate perspective, we really wanted to make sure that we were looking at all of the potential layers or levels of the organization, all the stakeholders, and making sure that we met them with an appropriate level of resources, information, and of course the care and concern that people, wanted to feel at that time. So overall, we don't want to do it again, but I think we learned a lot, and we go into it with a lot of new skills and a new understanding of what we might want to chase from the beginning, as compared to things that we can do a little more planning, which would likely come later in the event. And with that, I'll turn it over to Dr. Smalley.
All right, busy slide, so I'm just going to hit the highlights of my boots on the ground experience at our Shell manufacturing sites in Louisiana and Alabama. So I think Hans hit on it already, but the global Shell Health policies and the FAQs are in place really helped me out. We're very clear. The things I would get questions about, vaccination, there was no vaccination mandate. And then we were going to follow the World Health Organization, the CDC, and local government requirements, and only do evidence-based practices. And that really helped me out. I didn't win all the battles, though. Despite all the evidence that I showed our general managers against temperature screening from the MERS and SARS experience, I lost that battle, and we ended up doing temperature screening at all the manufacturing sites as they would scan in the gate. Some of them wanted to do thermal scanners, but I talked them out of that. So they did use the non-contact thermometers, and we collected data, and that's I'll talk about that at the end, but quite eye-opening. Every week, I would get a third-party vendor, and they'd usually go straight to my general manager and would pitch something like antibody testing or something that was going to make everybody safe on the site. So it was a constant battle, but luckily, Shell is led by engineers. All the general managers are engineers, and they understand science, they understand data. And I believe most of them right now probably could still draw a Punnett square and explain to you sensitivity, specificity, and negative and positive predictive value, because I trained them. But I mean, some of the things that we did that was effective, social distancing. I mean, again, these are engineers, so 6 feet was marked off in the control rooms, in the meeting rooms. They installed plexiglass barriers. They did enhanced cleaning on any contact surfaces. And one of the big things was we had a self-declaration that every entrance to every site that said, you had to look at it, and when you badged in, said, if you have any of these symptoms, turn around, go home. And I mean, to me, that was one of the most effective things we did. Facial coverings. Now, this was an interesting thing. Obviously, we mandated facial coverings as part of that in the social distancing. But for our operators, they need fire resistant, flame retardant masks. So, and that there's not one on the market at the time. So we had a local employee. Let's see, y'all can see this. This is made out of old flame retardant uniforms. An employee, his mother was a seamstress, and they made these nice, cool shell masks, which actually worked out pretty well. I still have 2 of them. And then I'll just talk a little bit about case management. The first cases we had were contractors, of course, and typically I don't get involved with contractor care at all, but here I had to because nobody knew what to do. And we, in Louisiana, we had the first cases, I think, across the U.S. in Shell. So I was kind of ground zero. And initially, I had to determine all their exposures, who was actually exposed, who wasn't. We did contact tracing for them, and all the returns to work for the contractors. And then eventually, I handed it off to them to manage with their own medical support, with clear guidance that they use CDC guidance, and that worked out for the most part. Initially, I remember going to a face-to-face meeting with the health department, the Louisiana Health Department, right before the pandemic really spooled up, and they said that they would do all the contact tracing. And I mean, but once the cases started mounting, I mean, I had 600 plus cases in my three manufacturing sites in Louisiana and the small one in Mobile, Alabama. We had over 600 cases to manage ourselves. So we did all of the contact tracing ourselves. So I had my on-site nurses, I got a PA, medical assistants, me. I mean, we were answering the phone, doing everything, isolation recommendations, quarantine, and all the returns to work. And I tell people, it's like, I don't believe I've been that busy since I was an intern. Busy times. And then next slide, Dr. Marcos, temperature screening. So we collected data, as Eileen said. We did over 100,000 screenings across our manufacturing sites, and we screened out 1 positive case of COVID. So I'm keeping that one in my hip pocket for the next pandemic. Honestly, I think what worked best was the self-declaration. If you're sick, don't come to work. And then all of our social distancing, the masking, I believe that was the most effective measures we did. And that was my experience. And I'll turn it over to Alex, I believe.
All right. Thanks, Brian. So I'm the newest person to this team, and I looked up how long it would take for another pandemic to happen, and actually statisticians came up with the model, and it's supposed to be every 59 years. So however long you plan on living, you may experience the next one. If not, your children might. But I think we owe it to ourselves, and we owe it to our future children to take a good look at our learnings here. And I know people are tired of it, but we need to gather all that we've learned, and our own records management system eventually starts deleting things. So you need to go back. You need to grab everything that you developed during these last 3 or 4 years, and really save it and look at it and see what you can learn from it for the next time. So on the left side of the screen, as part of the process of reviewing, we came across some pretty good learnings. Dr. Berg already mentioned those guiding principles were very important to line out in the beginning so that people have some sort of a handrail or guidelines to follow, because every response ends up being local. You've got different countries that have different laws and regulations. You have different states with different laws and regulations, and they change so rapidly, especially early on during the panic. So the business leaders need to be able to have the authority, have the autonomy to make local decisions, but also to draw back on those guiding principles. So that was very important learning. Of course, there is a central support system from Shell Health. It's good to have resources, having epidemiologists, industrial hygienists, human factor specialists, and clinicians already on staff, already employed to provide expertise was very useful. But we understand not every business is going to have those kind of resources. But using those existing resources, looking at the evolving science, understanding how we can leverage the organizations locally, regionally, and government entities as well. On the right side of the screen is kind of the reminder for our own Shell Health organization on what our guidelines are. The 5 different operating asset classes that we're supporting, our core competencies within the Shell Health organization, and how we can provide some interventions. And this is not just for COVID, this is year in and year out, and what our stakeholders are, who we're beholden to, our employees, the business itself, and that we're one organization that works together with common goals. Go ahead and go on to the next slide. Okay, so this is fresh off the presses, still technically in a draft phase. We haven't officially made this the pandemic playbook of Shell Health yet, but it was important for us to figure out how the outbreak would evolve eventually to a pandemic. And I took this from the WHO, the CDC, to figure out these different phases. And once we've outlined the phases, we have to go back and decide, hey, where in the stage, in certain phases, are we going to notify the business? When are we going to take action? When are we going to recommend that they take action? And the action levels at certain locales may be different, because you might have different businesses there. You have different kind of assets. You have office buildings versus a manufacturing site versus an offshore platform. Even different industries are going to have different actions, right? I mean, if you have a hospital that everybody needs to come in to treat patients versus a manufacturing site or a power plant that you may be able to live with the skeleton crew, or a tech company where you're entirely working remotely. So it's going to be industry dependent. But the important thing is to be able to line this out beforehand, so you're not figuring it out during the panic of, hey, what do we do next? When do we notify the business? Is it too early? Is it too late? That way you're not caught flat-footed, and you stay ahead of it. The tricky part is, once you've gone through all the initial stages of trying to figure out what this is, to the maintenance stage of, hey, I think we figured it out. This is how we're going to work it until we get to the end of it. And then when is the end? When is it quote unquote over? When do we start removing restrictions? Because if you keep those on long past when the science supports it, it's going to affect the business. That's interesting because it's been years, and I would say probably the middle of this year is when we finally were able to remove all the restrictions and be back to where we were before the pandemic. That's my piece.
Okay, so that brings us to the end. I think in the end, I think we are proud of what we achieved, keeping our people safe. And I'm not aware of any shell asset that closed down during the pandemic. Even the offices, although there was hardly anyone there, remained accessible if you needed ink or you needed to print something. I personally continued to work in the office in The Hague mostly throughout the pandemic. And that's given our scenario where, with so many different assets, so many different people, so many different countries, and all with their local response. That was not an easy feat. But thanks for listening, and happy to answer any questions.
Yep. So, thank you all. I've got a slew of questions I've written, but I'm one of the cool things about being the MC for this is I get to ask the first one, and then and then I'll turn it to Janelle. And there was a term that you guys used having to do with horizon scanning, and that was interesting because some of the other TEPHI talks that we've had, that the various businesses, I'm going to synthesize what they said, was that declarations that might come from the WHO or local governments are too sluggish because there's a political or other dimension to it. And so that's where you get into issues such as travel restrictions or, that sort of thing. And one particular presentation, they said they relied on their buyers on the ground in these other countries who were reporting in that, hey, they're locking down here. So just be aware as it moves forward, which then leads to kind of question part B, is this notion. It was very frustrating to me that they dropped the term novel as this novel coronavirus, because as everybody here in this presentation has mentioned, the science was developing, the epidemiology was developing, but I think for the communications aspect, the public didn't understand that it may change. The notion of transmission while you're asymptomatic, that was a big game changer. So anyhow, I'm just curious, what would your response to that notion of horizon scanning? Because you're I suspect are doing this right now. I would imagine your organization is scanning the horizon as we speak.
Yeah, I'd like to take that question. You can pitch in, Alex. I think we actually also from the start very deliberately chose the words alignment when it came to the WHO or any other national public health agencies, realizing that we don't want to get too far ahead of organizations like that. But if especially based on local know-how, etc., that we felt compelled to act, that we wouldn't be restricted. And actually I was involved in that. We already had that experience in SARS, where the WHO declared that travel to Canada was unsafe, and that would have completely stopped our operations because operating our fields, everybody was flying from everywhere into Canada. So we said we aligned, but we didn't necessarily follow that, and we determined that for us the risk would be extremely low. And actually, in our whole company went through a reshape a couple of years ago, and as part of that reshape, we actually developed one team that does project development, and they were also given the specific task to do the horizon scanning, and some of our epidemiologists are in that team to actively do that. And knock on wood, I don't think we're going to be caught as flat-footed as we did last time, the next time around, you know, when it was, because, you know, we had a lot of people in China, and actually, you know, we were hearing all those stories, and we could have acted then. And in retrospect, of course, we should have. And we waited until it came to Italy.
It's funny you say it, because that's exactly what the previous presenter said, was that the buyers in Wuhan were making them aware of the decisions, but once it got to Italy, they knew it was you know, getting going there. So
Yeah.
So, interesting. So
Yeah, and like you said, the WHO is an extremely political body, of course. And I worked with them in the past, and you know, they're beholden to all the donor, or to the countries who fund them, and it's extremely political. So to completely rely, you know, on them, or actually any other national public health agency for us as a business, is really important, because you don't want to be wrong, you don't want to be too bold, but in local situations, we may need to act more proactively.
Interesting. So I'll turn Janelle, you're on the
I actually,
row. You guys are on the chat box.
Rocio is doing it,
called.
yes.
Yeah, okay.
Yes. Go ahead, Rocio.
yes, I have a question. How many employees were partially or fully vaccinated, global and in the USA?
You want to answer that?
So I would be unable to answer that question because we did not have a policy that required vaccination, and we did not require personnel to share that information as a policy for the US. I don't know that any country, at least in the Americas, and Dr. Berg could probably answer globally, but unless it was mandated by a government, we did not collect that information or hold it. And certainly based on our privacy policies, we would not have shared that information other than, you know, a gross number. But we had no need for that information based on our policies.
And
Yeah,
I can,
think sorry, go ahead, Brian.
I can jump in right before ETS was about to drop, and we thought everybody was going to have to get vaccinated. We did an anonymous across Shell USA, and I had access to so it was anonymously asking people who would get vaccinated, and I can tell you the numbers were extremely low. I mean, it was like 20% for the manufacturing sites that said they would get vaccinated. It was higher for the staff folks, the admin people, but yeah, our employees in the sites, it was like 20%.
Yeah, and I think you know, we made a deliberate choice around that, because we honestly felt that for us to assume public health responsibility in any country was something that, you know, was a job that we just could not fulfill. So it was a promise that we couldn't make, and it would have been dishonest to try, and it would have led to a lot of inequity.
Okay, next question. Planning is key for a future event. What do you foresee planning will look like for future events for global companies such as Shell? And will you continue to review these response continuity plans? And does Shell have a special department for response plans? Or was this a collaboration with the safety team?
I think you can answer that. Yeah, we can jump in. It's okay.
So as far as do we have an organization, we do have a global emergency response team that handles all kinds of different things, and they were mobilized in the beginning to coordinate and to help the different countries, you know, in the interim until they got their own policies started. They also are responsible now for the business continuity, and they have a global set of folks in their organization to manage that. I do know that, you know, for example, Dr. Nguyen has been working on a pandemic response plan. There are other businesses that are doing the same. And like all good organizations, we review our plans and policies on a regular basis. So that will become part of the history of those documents to be reviewed at some regularity.
Yeah.
I don't remember what other questions there were.
Yeah, and I think the plan that Alex referred to is the the pandemic response plan for us as a health function, to really make sure that, you know, we are proactive the next time and can quickly put things in place. And actually from the SARS experience, if we, you know, we could have known that those remote areas, those maritime areas, those offshore areas, those are the ones that you really need to have, you know, front of mind right away, because that's where the risk is higher. So yeah.
So the other thing I would just add is that we now have a business continuity plan team, you know, globally, and they meet regularly, and it's funny. It looks exactly like the global pandemic team. And now, you know, right now they're focused on cyber threats, but yeah. So I think Shell learned a valuable lesson with COVID.
Yeah, I think all those teams were locally in place, but they weren't as connected internationally like they are now, and that I think was an outcome of the pandemic. That of course everybody was struggling with the same issues. So I think that whole network was very much strengthened, and it was realized by the top of the company that they were really important folks to have in our company.
Alrighty, Dr. Burke, I have a question. How did you prioritize the items or activities you included in the handrails document?
Yeah, I think we just kind of focused on, I'm not sure that we had like certain conscious criteria or anything, to be honest. I think it was mostly based on what people were struggling with. And actually I was in, you know, the chair of the IOGP, the Oil and Gas Producers Health Committee. And that was actually very useful at the time, because everybody would come to those committee meetings with their issues. So at some point you knew, you know, what the issues were that people were dealing with, and where it was important to have that consistency. So you cannot have, like I said, different evacuation criteria for different people. You know, I mean, Brian mentioned the temperature screening. Of course, in some places that may have happened, but generally that did not happen. You know, because we said, you know, that's really not a useful thing to do, and it's a waste of time and money. So I think that it was just by listening, I guess, and finding out on what issues consistency was really important. And like I said, it was those issues that I mentioned, social distancing. Like, again, you know, you don't want one office to do something completely different from the next. You want testing regimes, vaccination policies, and all of those things to be the same, because people are emotional about those things, and consistency is important.
Hey, this is Bob. I'm probably speaking out of turn here, but for the person who submitted that question, I would suggest that what Shell did intuitively is to follow the NIOSH hierarchy of needs, that kind of well-known formula going from, let's go from prevention all the way down to, you know, through administrative controls, blah, blah, blah. But I'll bet they probably did it without looking at the famous pyramid. You probably did that intuitively. Is that a fair statement?
I mean, I think industrial hygienists were very much part of our response team, right? And that's really, you're right. That's exactly, you know, how they think, and actually that's how we approach all risks.
Right. So for the person who sent the question in, you know, refer back to the NIOSH hierarchy of needs may help address exactly the question, I think. So.
Okay. It was mentioned earlier that after the pandemic, there was a shift made toward DEI and equity. What specific factors occurred during the pandemic which made Shell realize the shift was needed?
So I don't know that there is necessarily something that drove specifically that change. Our organization has always had a focus on DEI. I think we became very focused toward the end on the equity piece, making sure that everyone was treated the same when it came to things like returning to the office full time versus in a hybrid mode versus, you know, being able to continue to work remotely. I think there was a lot of focus on our ability to accommodate, as we were kind of working through the end of some of those responses, things like social distancing and face coverings, and making sure that we were thinking about the different needs of different groups in our population. That's DE&I has certainly grown in importance, I think I would say, for our organization as we've moved past the pandemic and we're all together again and we have the opportunity to have those conversations. But it was definitely something that as we were finding new ways of working that we made sure that we were addressing.
Okay. Alex, is there something you learned later that you wish you could have implemented sooner?
Ooh. So my experience was pretty varied. When the pandemic first started, I was actually in residency, and I got to see the government response regionally in Texas before moving on to private enterprise. So I think understanding resourcing and the need from the government perspective it was just astronomical how much they would need, and I was like, this is unbelievably overwhelming for a government entity to handle at that stage. So making those relationships early on with businesses, with the government, I think would have been better for the response from my experience. The business side of things, I think understanding the general sentiment amongst the population, right? Understanding the different working populations because I was at Exxon right after that. And like Brian said, the manufacturing sites are different. The corporate sites are different. Vaccine mandates at a manufacturing site versus offshore population versus your office folks. It's going to go over very differently. So the understanding your people and the communication and the decisions that are made to do that is going to be crucial.
Yeah, you don't want to meet the emergency response people when the building's burning down. You want to kind of know those folks ahead of time. Right? The same thing with public health, right? You kind of want to know those folks ahead of time. So, okay, looks like Dr. Rios. I don't know. Are we bringing in for a landing here? You're muted, Janelle.
Yes.
Okay.
We might be able to squeeze in one more question about early detection. Sorry, Rocio, to step on your toes here. One quick question. CDC has a national wastewater surveillance system that they're building to track the presence of SARS-CoV-2. Can you share your opinion of using this in the United States as an early warning signal tool? Thank you. I'm not sure if you guys know about it, or that TEPHI also has an early detection system using wastewater science.
I mean, I think I'm all for it. It's automated. We're not going off and collecting from individuals. You can get it all in one place, and it's the time lag of when you detect it is minimal there. So I think it's an excellent way as an early predictor of what's going to happen going forward versus looking at hospitalizations, things that are good lagging indicators. But I think it's a good tool that we can use, and I know TEPHI's very much involved in that, right? From a local, regional perspective.
Yes, in the state of Texas. And I agree with you wholeheartedly. It's cost effective and it's non-invasive. And it gives us a lot of data, a lot of information so that we can detect trends out in the communities and let the healthcare providers know about it so they can prepare their hospitals or emergency rooms and so forth. So thank you. Thank you, guys. I think that is all the questions, and we are right at time. I'm sending it back to you, Bob.
Okay, well, first of all, thank you all for taking time out of your busy days. You've got a lot on your plate, and we really appreciate you sharing your observations and comments and your experiences. This is invaluable. I actually have several questions that I'll email to you. I didn't get to my question, but this will be recorded and made available to the folks who are participating, and also, we will get an evaluation that goes out, Janelle, on this thing at the conclusion. But again, thank you so much for this. It's really, really useful for all the folks in Texas for us to be more resilient as we go forward. And happy holidays, by the way. Everybody have a good
Yes.
holiday.
you.
So
You too.
special,
Bye.
special shout out to Dr. Sanchez, the guy behind the most
That's right.
qualified guy right now.
Thank you all.
Okay.
Thank you all for having us.
Thank you very
Bye.
much.
That's it.
Bye-bye.
All right, bye.
Bye-bye.